Hi, I'm Jalisa, Lynn with the digital team, and I'm here with Tariq Nayfeh, the director of the Joint Replacement Center at MedStar Harbor Hospital, and we're here to do a Facebook Live chat. How are you doing today?
I'm doing great, Jalisa. How are you?
I'm doing well. So we had a few questions come in through our Facebook page, and I'm going to pull it up right now. All right, so our first question is, I have arthritis in my right knee. It swells and it's so painful. Will it need to be replaced?
Well, it's always hard to tell if a knee needs to get replaced until we get a good examination and look at your x-rays. So a lot of reasons a knee can swell. It can be minor cartilage damage, it can be a meniscal change. It might also just be that the muscles need to be conditioned. So the best answer is come in and get seen before I can answer that.
Okay, that's great. And here we have one more. And I need a knee replacement, but keep putting it off because I don't want to have to stay in the hospital, and I don't want someone to stay with me at home. I'm very independent and don't like asking for help. Why can't this procedure be done on an outpatient basis?
So we are evolving into doing knee replacements on an outpatient basis. We're trying to get our patients home within 24 to 36 hours, and sometimes we can even get you home on the same day. The hard part, though, is when you're at home, sometimes it's hard to get up and move around without a little bit of help. So it would be good to have someone there for a couple of days, but you don't need someone there for months on end.
Okay. Let's see. Why do people have pain on the outside of their knee after knee replacement surgery?
Well, there's a lot of reasons you can have pain on the outside of the knee. Sometimes it's just during recovery the ligaments get stretched. It's also very common to have numbness on the outside of the knee because the skin nerves come across the front from the inside to outside, and when you have your incision, we cut those skin nerves and the knee can go numb out there. And after you recover and given some time, it does improve.
All right. I had my first knee replacement 2014, went perfect, second replaced 2015, still in pain and tightening behind the knee. Knee keeps popping during the day and night. Doctor says everything is okay. Should I have a second opinion?
If it's been more than a year, I think it's a good idea to come in and get another opinion. In the first year, you can have changes, and it can still be in the healing phase. And no two knees are the same, even if it's on the same person.
Good to know. Let's see. How long does it take to recover from knee replacement?
The recovery varies from individual to individual. So some people recover very quickly, and others take longer. It seems like the people that have the most pain before surgery but have been able to maintain their strength have the fastest recovery. I let my construction workers go back to work in about 3 months. My patients who work in an office setting, usually between 4 to 6 weeks, we have them back to work.
Okay, great. Let's see. I need my knee replaced, but the doctor won't do it because I'm obese. They say lose weight. I'm trying, but it's hard when you can't hardly walk. Can you help me?
Well, the reason that we recommend weight loss before knee replacement surgery is for a couple of reasons. One of the reasons is that we do know that there's an association with higher weight and higher complications. So the infection rate's higher, especially if your BMI or body mass index is over 40 to 45. So I like to, in my patients, get you on a metabolic weight loss program, and we want to see as your weight comes down. If you show a downward trend, I tend to operate sooner. If you're having a lot of trouble, then I recommend you see a nutritionist or you get into a metabolic weight loss program, such as some of the commercially available ones you can find in town. I'm not really going to mention any of their names here. Mm-hmm. And a lot of times talking to your family doctor about doing things to pick smart foods will help a lot with that. Mm-hmm. There's now a trend in the insurance providers and in Medicare where there's an absolute cutoff. If your BMI is above 40, not to have surgery. I tend to look at the individual patient and see where we can fall in that patient's continuum of weight loss to decide at which time we do the surgery.
Okay. And what is an artificial knee made out of?
Well, that's a great question. I've got a couple models back here. So artificial knees, for the most part, the top part or the femoral component is usually made out of cobalt chrome. And there are some that we use out of a material called oxinium and sometimes a little bit of titanium. In between, which is the weak point, is a plastic called polyethylene. This is the same nylon you find in office chairs, for example, in their wheels. And then down in here, we usually have titanium or cobalt chrome.
And how come after the surgery of both hip replacements, you still have severe pain in your legs after a year has passed?
So that's a good question. You know, when you have pain that's severe in your legs, it may not be coming from your hips. There can be other reasons for that. And the best way to answer that is to be evaluated and have someone check you out comprehensively. So you want to look at your spine, you want to look at the nerves, and you want to look at the muscles in addition to your actual joints.
And who makes a good candidate for outpatient joint replacement?
So in our program for outpatient joint replacement, the people who are good candidates are individuals who are motivated, who want to be moving, and who are overall pretty healthy. You know, someone with bad heart or someone with bad lungs, we really don't want to send them home immediately after surgery because we want to be able to watch and see how they recover. The other people who are good candidates are those who have a good support network at home. If you can go home and you have people that help you out, we usually like to do healthier people. One of our biggest challenges is that some insurance companies won't let you have an outpatient joint. You may have to spend at least 24 hours in the hospital. But for the most part, if your insurance allows it, you're healthy, you're motivated, and you have a good support network, we can send you home the same day of surgery.
That's great. And how many years does a knee replacement last?
So that's a good question. And most well-done knee replacements should last between 15 to 20 years.
Okay. And how about for hip replacement?
Again, most well-done hip replacements, we're looking between 15 to 25 years survival.
Okay. What are the advantages and disadvantages of outpatient joint replacement, and just the disadvantages and advantages?
So the advantages to outpatient joint replacement is, number one, you're out of the hospital environment. And we know that hospital environments and rehab centers, despite all what we do, there's a chance of getting a higher chance of infection. If I get you home in your own bed, you're sleeping better. If you're eating your own food, you're eating better. And the other thing is you tend to recover faster. And when we look at our studies now, the patients that go home faster tend to actually have a better long-term outcome. They have less infection rates, they have less DVT rates, they have less pneumonia rates.
Okay. I'll just have one come in. How old is too old for hip replacement surgery?
Well, my oldest patient is 102.
Oh, wow.
And my youngest was 19.
Okay.
So there's no real age cutoff. For the older patients, what we look at is how healthy they are and how active they are. So if they're healthy enough to handle the surgery, we know they're going to get up and move, and they have and it will improve their lifestyle significantly, then we will consider doing the surgery. And in our younger patients, what we worry about is how long the joint's going to last. So we try to put it off as long as we can, because when you're younger and you have the surgery, we know you're going to have it redone.
Right. Okay. And how much pain will one experience after the surgery?
So that's interesting. Pain is different from individual to individual. There's some people that stub their toe and they cry for days,
right.
And there's other people that stub their toe and keep walking with no problems. And so you can't really answer that question. We do know that there is pain involved, but it's not predictable how much. And a good measure of how much pain you have after surgery is how much pain medicine you're taking before surgery. If you're taking a lot of pain medicine, you tend to be more sensitive to pain, and therefore you're going to have more pain afterwards. So if you want no pain after surgery, don't take pain medicine leading up to it.
Right. Okay. And what do I need to do to prepare my home for recovery after joint replacement?
So to prepare the home after surgery, the most important thing is, number one, have somebody there.
Okay.
The second thing is we want to try to remove obstacles to walking. We don't want a house that's got a cluttered floor. Okay, we don't want loose carpeting on the floor because you could slip on it. And we want pathways through the house where you're not going to have to trip over furniture or maneuver through tight corners. So try to declutter the home, get rid of things you can fall over, and try to identify someone who can support you during your recovery.
Great.
And if you are going to go home quickly, I recommend you make some homemade meals and freeze them so that you can heat them up rather than trying to prepare new meals. But we want your own cooking. We want healthy foods. Right. We don't want foods out of cans and bottles and boxes or from fast food, because they don't tend to be healthy. They don't have those building blocks you need to heal.
Right, that's great advice. Well, thank you so much, Dr. Nayfeh. That's all the questions that we have today. If you have any more questions or you want more information, please take a look at the comment section below.